Hello, this is Dr. Priyadarsh and I'm working in Shahid Hospital and I'm also helping in Yumetta Foundation. Since last 1 month we are working in COVID care hospital, COVID care center, and I want to share few observations what I saw in COVID care centers and the problem statement and how we are going to respond to it. So the first thing we saw was that there is a lot of misinformation about COVID disease as such, and people are still fearful to do COVID testing. There is delayed detection, then there is also delay in initiation of treatment. The patient don't know about the symptoms of COVID, and many patients don't know that what is the red flag signs when they have to approach to the hospital. So we are seeing this in so many patients who are coming to our hospital or when we talk with their relatives. So this is a very common thing they are telling. There is a lot of misinformation going on in WhatsApp or in social media, and patients are not able to take proper decision. We are also seeing that there is a lot of patients who are having comorbidity don't know that which comorbidity should be taken seriously, and they should get referred to hospital as soon as possible, as soon as they get any symptoms. The third one we are seeing is that there are very few testing centers, and because the RT-PCR lab are very few in many places in India, so there is delayed results for RT-PCR. Also, the sensitivity of RT-PCR and antigen is low in this second wave, and we are seeing that around 30 to 40% patients are false negative. So what exactly is happening because of that? So a lot of the patients we are seeing are false negative patients. They have all the symptoms of COVID, but then their test is negative. So the patient will either get carefree and he will roam here and there and spread the infection, or the other hospital will not initiate the standard treatment for this patient, like standard COVID treatment. If the patient is COVID positive, we will try to treat them aggressively in dedicated COVID care centers. But if the patient is COVID negative, the patient will not get admitted to any COVID care center. The private people will not treat them as COVID, and then we are observing that there is high mortality among suspected patients as compared to COVID positive patients. So these are all the things we are seeing at ground level, and there is also unknown. The people are not knowing the concept of silent hypoxia. So they don't know that they will feel okay, there will be no symptom, but still in silent hypoxia condition, their saturation will go on dropping, and then once the saturation reaches less than 85 or less than 80, then they will start getting symptoms of breathlessness. Then they will try a rush to hospital, but then it will be very late, and then we might not save that patient. So the patients who are coming to our hospital is based in a rural area, and it is covering two, 3 districts. So the patients who are coming in our area, so they are coming very late, either 4th or 5th or 7th day or 9th day of getting symptoms. They most often they didn't tested themselves for COVID, and then they don't know that whether they are COVID positive or negative. Once they come to hospital, then only we test them, and then they are coming late, and they are coming with a saturation less than 70, less than 60. Some are coming with saturation around 35, 40, 50. So it is getting very much difficult to treat them at our level or at any level, and then once they are so late, we cannot help them much. So these are all the problems we are seeing, and but most of the people who are trying to help the COVID wave are focused on tertiary care centers. They are building more and more COVID care hospitals. They are donating ventilators. They are giving oxygen saturation and other things. But I want to tell you that in these centers, very few people will get admitted. Those are from cities or nearby area. The people from village area who is COVID positive or who is suspected will never be able to reach those area, and even if they reach there, they will not get the bed or any services there, because the cost of treatment might be very high, and in the government hospital the patient will not get bed. So the patient always prefer living and dying and getting treatment at government hospitals in peripheral area or some of the NGO hospitals. So this is very shocking scenario, very stark difference between urban and rural setting. In India there is 65% people living in rural area, but still we are not focusing on primary and secondary level of prevention. These are the problem statement we are seeing at the ground level. But it's not good just to talk about problems. So what are the solutions we are offering? So seeing this, that there is lack of information, and then there is no proper mechanism where somebody can know that what exactly is their problem. They cannot know that they don't know whom to call when they are in any form of distress. So what we are providing is a solution is a call care center, and the call care center will be the calls will be received by volunteers who are trained in COVID, in counseling, and also in grief management. And each set of 10 or 15 volunteers will be given a backup by a doctor. So if any distress call come from a COVID patient or some relatives of the patient, and the volunteer cannot answer those things, then the call will be shifted to the doctor, and doctor will give the proper information to the patient, or they will also help them get proper prompt referral. So in this way we are trying to help the rural and tribal belt people with the source of authentic information where they can. Second thing we are trying to help is build a village based monitoring system. So we are trying to give pulse oximeter to village health worker or Asha, Mitanin, Anganwadi, or any village volunteer who want to take this task. And with this help, what we are going to do is test the oxygen saturation of all the COVID positive home isolated people, all the suspected people who tested COVID negative but still having COVID symptoms, and any person who has not tested yet but have the symptom of COVID. So we are trying to measure oxygen saturation of each person who is having any symptom of COVID morning and evening, and whosoever will have the saturation less than 94, we will refer that patient to the call center doctor. The call center doctor will talk with the patient, verify that whether the patient needs referral or not, and then they will make sure that the patient gets urgent referral. So these two things will help in primary and secondary level prevention, and also the problem of silent hypoxia, in which patient having oxygen saturation between 94 and 80, we can catch them early and we can refer them early, so there is more chance of this patient surviving. If we are late, then the patient will feel breathlessness only when the saturation drops below 85 or 80. Then they will get referred to some hospital, but then it might prove too late for them. The third solution we are offering is training of the health workers, whether they are from government agency or from non-government agency. We'll train them about COVID, counseling, then different phases of COVID, and what exactly they should do when they come across any patient who is having symptoms of COVID. The fourth thing we are trying to do is capacity building and forming community care centers or community isolation centers for COVID, because in many of the rural and tribal area, the facility for home isolation is not present. They are living in a small home with the same toilet and same kitchen. So then there is a high chance that they will transmit this information to others. So then what if some community center is there, and then it can be furnished and be kept specifically for the patients who are having COVID positive, so that other members in the community and the household members can be protected. And last one is we are helping COVID care centers with some equipments, and we're trying to help them with the manpower also, but then mostly with the equipments if they are feeling any lack of equipments. Maybe we are trying to collaborate with different NGOs and government agencies so that we can all work together in this COVID crisis. So what exactly we are offering to the people? So we are offering a technology of call center. So any government agency or any NGO who want to help the people in their area with authentic information can ask collaboration with us, and we will be happy to collaborate. We'll just enroll 20 or 30 or 50 volunteers from that area, and then whatever calls, whatever problems, whatever questions from that area, those volunteers will start answering, and we will do all the training of those people who will be enrolled as volunteer. The second one, what exactly we are offering is training for the government staff who are working at field area, or also training of the NGO volunteers or workers who are working at grassroots level. So we want to train them, and we have a team which will train them in all the aspects of COVID counseling, and also helping them for prompt referral. Another one is where we can help to have makeshift isolation centers, and then maybe help in telemedicine of those patients, or we can also help with some equipments, if not all. We should collaborate with the government system and the NGOs, because in this COVID crisis, the single person, single agency, if they work alone, it will be very difficult for them to address all the problem. So I think collaboration of government and NGO system is important, and we will be very happy to collaborate with anyone who comes forward and asks for help, and we will offer all the things we have, and we'll be very happy to help in this situation. So this is it. If you feel that we can collaborate and start work at your area, or your volunteers want to help in the call center, you can enroll with us. We'll provide you training, and then you can start that work at your area. Also with the training part we can help, and other things, and collaboration. So this is Dr. Priyadarsh from Shahid Hospital, and also from Yumetta Foundation. Please stay safe and be healthy. That's it.